I think keeping our brains engaged is an important part of maintaining brain health as we age. I think there are some kind of practical ways that we can really take steps to boost our brains in our daily lives. And learning new things is a great way to do that. So, for example, learning a new language, which is really, I think, considered to be the gold standard for kind of learning something new and supporting cognitive health. That's because learning a new language is complex. It's a difficult activity that really makes use of your brain in different ways than we typically do. It really provides a workout for our brain. Um, Also, taking up a new hobby that requires us to learn something new or volunteering in a new setting. These are kind of different ways that we can really boost our brains and maintain brain health. Um, Other activities might be something as simple as taking a new route home every time you're returning from the grocery store or driving home from work. The key is to really change it up and do something different than the typical route that you take. This is something that's kind of challenging to our brain in a seemingly simple way that we can really incorporate into our daily lives. Many of us tend to worry when we forget a name or when we misplace our keys. But forgetting a name is not necessarily something that's a cause for concern, right? As we age, some changes in memory are normal. We've also gathered a lot of memories and data, right? Within our, and I like to kind of think of it as this part of our brain is kind of like a filing cabinet. The more files with information we have, the longer it really takes to sift through those files to find what we're looking for. So some kind of delay in recall or even forgetting details can really is really kind of a normal. It's often really a normal part of the aging process. I also don't really worry so much about someone misplacing their car keys. That's pretty typical behavior. I often really have to hunt for my keys when I'm leaving the house. What I do worry about is when someone forgets what their car keys are for or what a car key is. That is something that would really kind of be a sign that professional guidance might be warranted, right? It's time to think about having a conversation with your primary care provider or other professional. Other signs that are potentially concerning are significant changes in the ability to manage money and finances. If someone has been really good at really maintaining their personal finances and kind of keeping track of their spending and so forth, but now they're really kind of starting to struggle to track that, that would be cause for concern. Other kind of major changes in behavior would also be a cause for concern. So, for example, major changes in personal grooming habits or taking care of one's appearance. If someone stops taking care of themselves, that might suggest a need for conversation with, again, with primary care provider or other professional. So we know that loneliness and social isolation are really not good for our emotional, mental, or our physical health. This is true for all ages, but it's particularly true for older adults. So it's really important to stay socially active as we age. And social activities can take many forms, right? So it might be spending time with friends or with family. It might be participating in a hobby where you meet and interact with other people. It might be a job uh, that you work in that really provides, again, that interaction with others, but also provides, meaning and purpose. Um, it- these types of activities really kind of help us maintain our emotional, our mental, and our physical well-being as we age. So I think I think there's really better awareness that there are a number of what we call modifiable risk factors for dementia and cognitive decline. Regular exercise, maintaining a good diet, getting an adequate amount of sleep every night. They're all kind of well-known, backed by solid research, ways to keep your brain healthy and to really support cognitive function as we age. Social engagement is another important component of brain health that's backed by significant research. Um, and there are kind of a lot of parts of social engagement, right? That might be connecting again with friends and family. Um, it's really important to have friends as we age. And to be fair, it often takes a lot of effort to really maintain those friendships and relationships or to make new friends. But it's really really important. But I think there are kind of other parts of social interaction within our daily lives that are important beyond friends and family, right? It's also being part of a community. That might be something as simple as, interacting with people on a regular basis at your local coffee shop or at the grocery store. It might be regular interactions with other people who you volunteer with for a specific cause or a specific organization. Um, to be sure, work and volunteering also play really an important role in our social lives. Um, a part of that might really be again that purpose that comes from participating in those activities. So the Latent Aging and Alzheimer's Disease Research Center at Oregon Health and Science University is a great resource, both if uh, you're concerned about someone and their cognitive health, as well as it's a great resource to participate in research around the brain in older adults.